Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What is toxic adenoma or plummer's disease? Toxic adenoma or plummer's disease. Actually, in toxic adenoma or plummer's disease, here the patient has a single hyperfunctioning nodule. Because of this single hyperfunctioning nodule, this will result in hyperthyroidism in the patient. And this toxic adenoma is more commonly seen in younger patients than the elderly. Number one, this toxic adenoma usually occurs along with the endemic goiter. So it is most of the times it is associated with endemic goiter only. And this increased thyroid hormone which you see in toxic goiter, it is independent of TSH control. It does not have any effect on TSH control in the toxic adenoma. In toxic adenoma, here the patient will have recent growth of the nodule is seen. Actually, here most of the cases already the patient will have a nodule from a long time, but recently there is growth of the nodule is seen. There is recent growth of long standing nodule is seen with hyperthyroidism features. In such cases you should think of toxic adenoma. This toxic adenoma can occur due to mutations in TSH receptor genes. Because of the mutations in TSH receptor genes, the patient can have a toxic adenoma. In most of the cases, the size of the toxic adenoma is at least 3 centimeters before development of hyperthyroidism. Then, what are the clinical features of toxic adenoma? So, in the toxic adenoma, the patient will have a hyperthyroidism is seen in the patient because of sudden increase in growth in the long standing thyroid nodule. So, here on examination you will see that there is presence of solitary thyroid nodule will be seen, and mainly the cardiovascular symptoms of hyperthyroidism might be seen in these patients. All the symptoms of hyperthyroidism may occur, and these nodules are rarely malignant. In most of the cases they are the benign nodules. Then how are you going to diagnose this toxic adenoma? This toxic adenoma is mainly diagnosed with the help of radioactive iodine scanning. If you do a radioactive iodine scan, you will see that the nodule is seen which is a hot nodule. This hot nodule will suggest that in most of the cases it is a benign lesion. Then treatment. If it is a toxic adenoma, then the treatment depends upon the size of the nodules. See, if the nodule is a smaller size, no, not smaller in size. If the nodule is smaller in size, then it is better to give medications, and anti-thyroid medications can be given along with radioactive iodine therapy if required. We can give. Then after giving the radioactive iodine therapy and anti-thyroid medications, in most of the cases, the patient becomes euthyroid. Okay, but if the nodules, but there is surgery can also be done, which is hemithyroidectomy can be done in certain cases. What are the indications of hemithyroidectomy in toxic adenoma? In toxic adenoma, hemithyroidectomy is indicated if the toxic adenoma is seen in younger patients with larger nodules. In such cases, we do hemithyroidectomy.
thank you and thank you for watching.